Good afternoon, everyone. Today is Wednesday, August 20th, 2025. This afternoon, we are meeting as the Board of Social Services. I'm Kristen Stevens, Chair of the Board of Social Services, as well as Chair of the Board of County Commissioners. And with me is my fellow Commissioner, John Kafalis. Commissioner Shattuck McNally should be in shortly. And I will turn things over to Heather O'Hare, our Human Services Director, to kick things off. We have other people at the table, so welcome, everyone. You can introduce yourselves as you speak, and we're looking forward to this session.
Thank you. Good afternoon, Commissioners and Lorenda. Heather O'Hare, Human Services Director. First, my apologies. I did not realize that the best time that you get the agenda is when we send it with the presentation. And the presentation was just finalized late yesterday, as there are a lot of moving pieces. So we will make sure to disconnect that in the future if the presentation won't be ready at the same time. But we are going to cover very brief federal updates so that you all know what we know up to this point. And then we're really going to spend the rest of the time just talking about sort of the state of the department, both in a fiscal update, but also going into more details around what is the work looking like, the workload, volume, where we're at with the close of the fiscal year and starting a new one, and go into quite a bit more detail around some of the client outcomes and impacts in a couple of program areas. So feel free to stop me and ask questions. There's a lot of detail there. But before we jump in, any additions to the agenda?
I don't have any additions, Commissioners. Any additions to the agenda? I think we're good to move ahead. Thank you.
Okay. So I'm going to turn it over to Jill. Jill's going to walk us through the updates, and she'll introduce herself as she starts. I did want to just share very quickly the Colorado Counties, Inc., CCI, as your association, does have a conflicting meeting here at 2. So my understanding is that there is not going to be a vote taken today. They don't anticipate a vote, but they are going to give a high-level overview on a bill that's going to be introduced tomorrow as part of the special session. So Jill will introduce that as part of the federal updates, what the state is doing to prepare. So that is part of the agenda with CCI at 2, and I'll just make sure to add on that level of detail when we get to that slide so that you all are aware. Okay, I'll turn it over to Jill.
All right, hi everybody. My name is Jill Mosh. I am the Division Manager for Operations and Organizational Development in Human Services. So we're going to talk through federal updates today from the HR 1 or One Big Beautiful Bill Act. That was approved and voted on July 1st or July 4th. It includes a variety of tax cuts that lower the federal government's revenue. And to compensate for that revenue loss, the bill changes certain government programs, including Medicaid and SNAP. And about a quarter of the people live in Colorado in families that participate in one or both of those programs. So you'll see here, there's just high-level information about the changes that are coming to SNAP and Medicaid. So for SNAP specifically, in HR 1, over $186 billion in cuts to SNAP will happen over the next decade, with nearly 3 million individuals losing access, and an estimated increase in cost to Colorado alone of over $191 million. So high-level changes to SNAP include work requirements for able-bodied adults. So this is going up from age 54 to age 64. Limits to SNAP eligibility to U.S. citizens or lawful permanent residents is also going to go into effect with this. And that begins October 1st of 2026. This will also eliminate SNAP Ed, which is a program that in 2024 served 13,000 adults and 17,000 children with direct outreach and education through this program. And approximately 297,000 Coloradoans receive benefits through food pantries. So this program will be eliminated in fiscal year 2026. Additionally, there will be numerous costs shifted to the states. So you'll see a reduction in the federal administrative match for the program from 50% to 25%. So that's a reduction in the amount of money that we'll be getting from the federal government. Colorado expects to lose approximately $50 million, and that's also effective October of 2026. And then this also will be adding a requirement that states pay a portion of SNAP benefit costs based on the state's SNAP payment error rates, which is we often refer to as PER. And that's also effective in October of 2027. So you can see here there's a chart that talks about what level of PER is associated with what level of match. Currently, Colorado State has a PER rate that falls into the range of 8 to 9.99%. So we're about 10. So that means that there will be a 10% match, or roughly $125 to $160 million that Colorado will have to pay towards SNAP when this goes into effect. Additionally, in fiscal year 28, states will be allowed to choose which PER rate that they use to start this match. So we can choose either fiscal year 25 or fiscal year 26, whatever our PER rate was for that year, to calculate our match percentage. And then beginning in fiscal year 29, and for each subsequent year after, it will require states to use their PER from 3 fiscal years prior to determine the match rate. So an example is in fiscal year 29, our state match will be based on our fiscal year 26 PER rate. And then in fiscal year 30, it will use our PER rate from fiscal year 27. So those are some high-level overview of what's changing in SNAP.
Questions? Go ahead, Commissioner Cavallis.
Thank you, colleagues. Thank you, folks. Jill, thank you, Jill. I'm 2 questions on the SNAP, and I mean regarding. Well, first of all, it's been said often that with the work requirements for able-bodied adults up to age 64, that one of the consequences of that will be a lot of folks will lose their SNAP benefits. Can you explain that? And then my second question, if I may, is the second bullet point about SNAP eligibility. I may be having a brain lapse of sorts, but I thought that only U.S. citizens and lawful residents could access SNAP, so I'm not quite sure about that one.
So let me take your first question.
Yes, ma'am.
Around the impact of the work requirements, and we have on the next slide we will have a work session on October 8th where we're going to dig into a lot more detail and look at Larimer County specific data on the impacts. But what I would say is listening into a lot of the congressional committee discussions, and what we've been talking about internally is I think we have to start from the place of there was the intent with this bill to reduce the number of people receiving SNAP and Medicaid. There is a thought that surfaced very loud and clear in the congressional hearings that there are too many people receiving these 2 benefit programs. So unfortunately, I think we are going to have to reconcile the fact that there will be people that fall off, and that was part of the intention. Whether we agree, disagree with that is not really relevant at this point, but that's what was signed into the bill on July 4th. The impact of the SNAP the work requirements, there are varying levels of impact by the counties. So there are 18 counties that have had a complete federal waiver to work requirements entirely. Larimer County was not one of those, but 18 counties have unemployment rates that are too high, and so they were given a federal waiver. For those 18 counties, that waiver stops on October 1st. So there are very significant impacts for those 18 counties, all of them with the exception of Pueblo. So Pueblo is the only large county on that list, but the remaining 17 counties are small and medium counties. And so the impacts for those counties will be significant. For us, it is going to be, I would say, much more of a workload and fiscal impact for the county to administer this. There will be, CDHS, the State Department of Human Services, estimates that as many as 75,000 Coloradans might fall off of SNAP because of the work requirements. SNAP and Medicaid, the work requirements are fundamentally different in HR 1. In SNAP, you can receive 90 days of benefits before you are removed from the program. And so when someone comes to us and they don't meet those work requirements, we enroll them in SNAP, knowing that in order to be able to find a job, they also need to be able to secure food immediately. So they can receive SNAP up to 90 days while we provide case management services on top of that to help them get a job. Medicaid, and why I say it's fundamentally different, the work requirements that Jill will cover here in a second, is you meet it or you don't before you receive any Medicaid service. So when people come to us to apply for Medicaid in the future, they have to demonstrate that they have met that work requirement in the month prior. And the other impact to that we are really trying to unpack is that there is no sister program that's being implemented to provide case management to reduce the barriers to employment for those Medicaid recipients. They meet it or they don't, and we send them on their way until they meet it. So we won't have funding or case management services to provide employment or other crisis services to help them meet that requirement. And so that's why I say there will be an impact of people through either program that won't meet these requirements, and how we're very strategic to try to address that need locally is something we're still having a lot of conversation about. The second piece around, so there are special populations that have an immigration status other than citizenship that are eligible to receive SNAP, and that is no longer the case. And that is one of the unfortunate pieces of the bill that was effective immediately when it was signed.
So including, when you say statuses such as refugees or
Yes.
or people that have been granted asylum?
Asylum, yes.
So those folks, under those circumstances, could access SNAP, but now they won't, they're not
But
able
now
to.
they won't be able to. And so that is one of the components that was effective immediately on July 4th. But states haven't been given any direction from the federal office on what to do with those individuals and what direction the states need and counties need to then come into compliance. So we're waiting for that guidance from the federal partners.
Last question. Thank you, Madam Chair. Apologize. Do we have do we have a sense of how many folks will be impacted in Colorado that meet refugee or asylum status that no longer can access? Are we talking about 10,000 people? What are we talking about?
So I believe it's 15,000 statewide. We've been asking for a lot of these key data points from the Department of Human Services and Healthcare Policy and Financing. Jill's team has tried to run a lot of that data for us locally, and that's what we plan to bring back on October 8th to go into all of that detail, so you have a sense of, for Larimer County, what it looks like.
Thank you, ma'am.
Thank you. Commissioner Shannon McNally.
Thank you, Madam Chair. I hate to make you repeat yourself, Heather, but I'm just trying to wrap my head around what you just said. Because it's a little, I'm sure we're all very disconcerted with but I just want to make sure I understand. So this is so help me clarify, this is the new situation or the current, but is it, for the new situation is SNAP for 90 days, they can get food security for 90 days so they can be able to get a job and get services. And then also, so is that now or coming forward? But then you also said or is it just Medicaid, they meet it or they don't, and they can't get any services until they meet it. So I'm trying to understand, when did that kick in October 1st of next year, not in a month?
So for SNAP, it has always been the case that someone can receive 90 days of benefits. So that's existing, and that does not change under HR 1. That will still be the case. The work requirements are another piece that technically in HR 1 were effective as soon as it was signed. But the state has not received any guidance from the federal offices on how to implement that. So there are changes to the work requirements, but not changes to the eligibility timeframe. So people will still get up to 90 days of benefits before they would have their case closed if they're not meeting those work requirements. In Medicaid, though, it's a yes or a no. They either meet that requirement in the 4 weeks prior to applying, or they don't. But again, our understanding as we read the bill and as the State Department reads the bill is we will be instructed to tell them to return when they meet that requirement. There aren't going to be funded case management services to help them come into compliance with those work requirements. But again, we haven't received federal guidance from that department either. But I'll have Jill cover the Medicaid pieces, and then we can come back to and see if there's more specific Medicaid questions.
Thank you, that helped kind of, help me kind of
There's a
understand
lot.
where we're at. There's a
Yeah.
lot, and I was just like, whoa, wait a minute. So, all right, thank you, Heather, appreciate it.
I'm going to ask one more question about the payment error rates. So ours are a little higher than other places, I mean, statewide, I guess, right? And so what does it look like to get those error rates lower than 5%? Is there a possibility of that? And what constitutes sort of, and it's errors in people who are not necessarily qualified that get on Medicaid? I mean, is that what
Good
does that
question.
look like?
So the payment error rate is looking at overpayments and underpayments. And anything over the $50 threshold creates an error. So if we underpay someone $50 or if we overpay them $50, then it falls into the bucket where it contributes to our payment error rate. Our payment error rate for 2024 was 9.97%. We are actually in the lower tier for all states. There are very few states that have payment error rates under 10%. And Colorado is actually one of the lowest payment error rates for state supervised county administered systems, of which there are only 11. So of the 11 states that have very similar systems to us, we actually perform really well on payment error rates. And there's a couple of pieces. We don't have payment error rate data at the county level. We only have it statewide. So that is one of the things we've really been pushing the State Department for. And when we look at where errors come from, they fall in 3 buckets. There's errors that come from the client, not understanding what information to provide to us as part of their application or their income statements. So there are client-driven errors that are about 30%. Another 30% come from the Colorado Benefit Management System, CBMS, inaccurately applying a policy decision automatically in the system. That's another 30%. And then the remaining roughly 40% come from county errors. And what happens then in our processing. So there is a statewide committee. Vanessa Fuel from our team is participating in that, as well as Julie Griffith from Jill's team, to try to drive down our payment error rate. To get it below 5%, I think is going to be challenging. But if we can get county level data and then make sure that we are auditing cases in the exact same way that the feds audit the cases, that will help, at least in the short term. But I think it's unlikely that we will not see a match requirement moving forward. It's just how much will we be required to contribute.
That's really helpful. Thank you for explaining how that works. I did not know the threshold of error was $50. That's not very much money. So I could see why, being at 10% seems actually pretty decent amount of error because, there, like you said, there's all these places where that can occur. By potentially losing some administrative dollars, I mean, doesn't that make our error rates go up likely? I mean, yes.
Yes, very much. And I think another element of the congressional hearings was the comparison of payment error rates to fraud. They are not one and the same thing at all. The error rates are not fraud. The the fraud that we see is actually very few and far between in Colorado. It is just a very complex program to administer, and that's where it's the human errors, it's the policy errors.
And how are those errors determined? Are they self-reported, or are they something that you catch later on and you're like, oh yeah, we thought you were eligible and you weren't, and that creates?
So the errors are determined by the federal office. So the other issue is that they only sample 2,000 cases for all of Colorado, when we have 700,000 cases. So they only pick 2,000 in a year. And what they do is they actually go back to the beginning of the case and they rework the whole thing. They interview all of the family members, they dig up all of the documentation and income. So they walk through the same process that we do, but because they are redoing all of that work, it takes us 6 to 9 months to get the error rate after they audit. So the data we have is also very old, and that's a lot of the conversations with the State Department is, how do we get more timely data so that we can correct this sooner? When there is such a financial consequence.
Okay, wow, that seems really, okay. Well, we'll see what we can do about that, but that seems wrong, and also maybe a waste of time those dollars could be spent, those audited dollars could be spent better as well, so, all right, thanks for explaining that. Yes, Commissioner Cavallis.
Just, I seem to recall that maybe a month or so ago, there was a memo or a briefing paper, like a 1 or 2 page document that either came from the State Department of Human Services or Human Services Directors Association on this per issue. Do you recall that? And would that be helpful for us to resend that to us? Because it's in writing, some of these details that you've just described.
I'd be happy to resend it. It was actually our team that created it for.
Our team.
Yes, it was our Larimer County team that created it with
That might be helpful.
our peers in Weld. Yeah, I'd be happy to redistribute that. We will
Thank
get
you.
it to
I
you.
apologize that I may not have read that as carefully as I should have to get the details, but.
I read it, but I forgot it.
And it actually is really helpful for the community to understand why people are losing their benefits and what that looks like and how little control we have over that. So thank you.
All right, so next I'll cover changes to Medicaid, very high level. So this also, HR 1 limits the eligibility to U.S. citizens or lawful permanent residents after a 5-year waiting period. Medicaid eligibility redeterminations will be every 6 months as compared to every 12 months now. And then activity requirements will be enacted for individuals aged 19 to 64 with some exceptions, which is not ever a requirement of Medicaid in the past. This is going to drive a lot of administrative work on our end alone. I mean, thinking about the number of redeterminations that are moving from every 12 months to every 6 months, it's doubling the workload there. And then there will be limits on provider taxes as well. So HR 1 specifically for Medicaid includes an estimate of $1 trillion in reductions to Medicaid spending from 2025 to 2034, with an estimated 8.7 million fewer people covered by Medicaid over the next decade. And the eligibility requirements also will be enacted on October 1st of 2026. Okay. So then the next slide is just covering what are we doing and what work, are we doing moving forward. We are closely monitoring Colorado special session, which starts tomorrow. It will be focused on revenue shortfalls caused by HR 1, tax policy changes, impacts to Medicaid and SNAP, healthcare, and then AI regulations as well. And then additionally, we'll be joining you for a work session on October 8th. At 1:30, where we'll dig into more details about HR 1 and share more of the data that we've found throughout all the look-backs that we've done. We are monitoring additional federal action. So the president's proposed budget includes additional significant cuts to human services programs, so we're monitoring that, as well as another bill that's pending that's called HR 3156, which has drastic changes to the Temporary Assistance for Needy Families, or TANF program. And then we've created 2 documents that will help kind of track this information. The first is a federal updates tracker that Hannah on our team has been tracking all of the meetings and all of the executive orders that are released so that she can track details in this tracker. And then we're working with Shane on a 1-pager document that will specifically talk through county impacts as related to HR 1. And then there's another document that's linked here too, that's just a special session overview that shows what they're planning on covering in the special session that starts tomorrow.
So the one additional piece that I will add that's going to be covered here in just a little bit on the CCI meeting, one of the bills that we have seen that is supposed to be introduced tomorrow in the Senate Health and Human Services Committee is a bill to modify the language that voters approved for the Healthy School Meals for All. And modify it in 2 ways. One, allow the state to retain revenue from that because there was, I think, more revenue than initially thought that is then having to be turned back under the Tabor rules. So they want to be able to retain additional revenue so that Healthy School Meals for All is fully funded, whereas today it is not. School districts are covering the cost of that in some significant ways. And so retain additional funding, but then also be able to retain, once Healthy School Meals for All is fully funded, the remainder then, one of the allowable uses would be to help cover some of these additional state impacts for SNAP. So initial estimates show that if the voters were to approve this in November, it could produce as much as $95 million more. And about $25 million estimated is needed to fully fund Healthy School Meals for All. So there could be potentially $70 million in the first year that could help with some of these match requirements and help offset these changes for SNAP. So we haven't seen the fiscal note yet. Those estimates have been provided from Hunger Free Colorado. And so Kevin Neiman, who is the contract lobbyist for CCI, is going to give an update and just a high-level overview of that on the CCI call this afternoon. And then I will be testifying before the Senate committee tomorrow morning.
Thank you, Heather. Commissioner Cavalos.
Thanks, Madam Chair. Thank you, Heather, Jill. Because this has Tabor implications, is what will be referred to the voters, is that requiring a constitutional change or statutory changes sufficient? Because both of them have different thresholds for passage.
I believe it's a statutory change.
Okay. Okay.
But that's one thing that Kevin was looking into this morning
Okay.
when I chatted with him earlier today.
Okay, thank you.
Commissioner Shattuck McNally.
Thank you, Heather and Jill and everyone, just for trying to wrap my head around all of this. We've been talking about this, but trying to really hone in on this today. You said you're testifying today in front of this, or tomorrow in front of the Senate committee tomorrow, specifically on which topic? Or it's just in general, or which topic, and are they having you focus on?
Specifically for the Healthy School Meals for All bill, and it's not even introduced yet, so it doesn't have a bill number. That will all happen tomorrow morning. But just around really what we presented here on the impacts to county administration. And we're going to get into what is our own county administration funding look like here in just a second, but specifically why HR 1 will create more administrative costs to counties and more administrative work to administer SNAP. And I'll be, the SNAP director for CDHS is also testifying, so she and I are trying to coordinate on the points.
Excellent, thank you. I just wanted to clarify what it was, and I'm really grateful for your expertise in this area. Thank you so much.
Thank you. Okay, so much more to come around all of this, certainly in the next week as the special session happens, but then again on October 8th, we'll have a full hour with you where we'll dig into the data and really try to understand the impacts. that are to come. So with that, I will shift, and we are going to talk through in our, every year in our August board meeting, we present a fiscal update to you. So again, we are always navigating the county fiscal year, which is the calendar year, the state fiscal year, which is July through June, and then we do have some programs that run entirely on the federal fiscal year that starts October 1st. So we have just wrapped up, and the state has closed the state fiscal year for 24-25, and so we'll present where that wrapped up, where each of our programs landed with the closing of the state fiscal year, and then what does the funding look like for the next year. So just a reminder, we call them allocations. So each program has a dedicated budget with significant restrictions. We can't use the funding generally across programs. And about 82.5%, 83% of our department's funding comes from state and federal sources, with the remaining 17.5% coming from you all, from the county funding. And then so the county funding we use for a match or a maintenance of effort, and those are required percentages that the county is required to provide towards the total allocation. So we'll walk through what that looks like in each of the program areas, so it's a little bit clearer. And then we have TANF reserves, so temporary assistance for needy families. There is a pot of reserves that is used when we overspend TANF, child welfare, or child care assistance programs. So we'll walk through where that comes into play. And then we also have the department's fund balance, which is what we use when there isn't sufficient funding and we might overspend in one program area or another. So for state fiscal year 24-25, our total budget was just over 62 million. And there are 18 different funding allocations across the department. These are the big ones here, and just gives you a sense of which program receives what amount of funding. Again, all of our programs, with the exception of 2 of our smaller ones, are all braided federal, state, and county dollars. So this is just the high-level overview for the big ones. At the end of the state fiscal year, there's what we call the closeout process. So you'll hear me reference what happened in closeout. And it really is where the state looks to see, is there still funding left on the table, either from other counties underspending or sometimes the state underspending. And then they go through a redistribution process, and they redistribute that funding back to counties that are overspent. So we will call that out here where that happened across the programs. At the end of the day, there still may be overspending after the closeout process, and there were in 2 of our programs. That's what our TANF reserves or our department fund balance is required for, is to then cover whatever is left after the closeout process. So I'm going to cover, just on the heels of the HR1 changes, I want to cover the economic security programs first, so that you can connect those 2 with those programs. But Commissioner Kafalis, I think
Do you have a question?
Thank you. The Colorado Child Care Assistance Program allocation, the CCAP, 8.4 million for fiscal year 2025, the one that just ended. Does that include the additional 15 million that we were able to secure from the Joint Budget Committee?
Yes, and so you'll see that, I'll call that out specifically on that slide. And then in county administration, there was an additional 25 million that was appropriated by the JBC as well. So I'll make sure to call those 2 pieces out. That is included in the 24-25 numbers that I'll show you.
And what difference it made getting
Yes.
that additional funding? Thank you.
Yes, I will make sure to point that out. Okay, so for our Benefits and Community Support Division under Vanessa Fuel's leadership, so this is showing you the caseloads for food assistance, SNAP, and TANF. And so this here is actually showing you the dollar amount of the benefits that were issued. So again, under HR 1, the state would have to help cover a portion of the benefits based on the payment error rate. So for Larimer County, and we'll be reviewing data for the second quarter, so April through the end of June for 2025, Larimer County received just over 18.7 million in SNAP benefits. And it has been a steady increase since 2020. I'll show you the caseloads on the next slide. For Colorado statewide, it's $1.2 billion in SNAP benefits for 2024 for the calendar year. And so again, based on the payment error rate, we would have to cover 10% of that collectively as the state. In TANF, it's a much smaller caseload, but still significant benefit to the community. Over 1.2 million in the second quarter of this year were received in the basic cash assistance. So the monthly TANF payment that goes out to eligible households that are receiving temporary assistance for needy families. So this is showing you the same programs, but from the caseload perspective. So the first quarter of 2025 is the highest in Larimer County's history in terms of caseload for SNAP, over 19,000. So I included the table there on the left, just for comparison back to 2019. We have seen a really significant increase in SNAP households from 12,500 in 2019 to over 19,000 in 2025. And then the state level data as well, a significant increase statewide. So a variety of reasons. There has been a very intentional push for outreach so that those that are eligible for SNAP are receiving SNAP and they know how to receive SNAP. So we have driven this in some cases on our own. We have very strong partnerships with the food bank and CSU, where we help get people enrolled faster and more efficiently where we can. But also just as the cost of living across the state has increased, there are more becoming eligible too. And so it is really those two factors that's driving this. We roll up other financial assistance programs into the caseload here just because they're much smaller. So TANF, old age pension, and aid to the needy and disabled are three other adult financial programs. And we are seeing the caseloads grow there. 1,800 in the last quarter. And then our child support caseload, I know you all heard a lot about child support yesterday and the fantastic work that they do. They are just shy of 5,700 cases where they're collecting and then redistributing child support out to those families. This shows you a different perspective. So our lobbies, our welcome centers are generally people coming in to access the programs that I just covered. So this helps show over time, month over month, what the traffic looks like into the welcome centers across the three that we have. So 1501 Blue Spruce is by far the busiest, with almost 1,800 individuals coming into that lobby in June alone. With Loveland then being our second busiest, and our Midpoint Welcome Center, the slowest of the three, but still over 400 individuals that walked into that location in the month of June. So county administration is the name of the allocation that helps us administer eligibility for all of those programs with the exception of TANF, so I'll get to TANF next. But it is, I think there could be a much better allocation name for it. It is not paying for the county's administrative costs. It is paying for the program staff that administer those public benefits. but in statute, it's called county administration. So it is a compilation of really 3 funding streams. There is county admin that we get from CDHS for all of the programs except for Medicaid. And then there are 2 other pots that go into county administration from healthcare policy and financing specific to Medicaid. So we roll those together, and that is our county administration allocation. And it is calculated there. You can see on the right what are the factors that determine the formula across the state. And it's looking at the program activity, so the applications and the recertifications, and then calculates the amount of time for that. It's a very complicated formula. After many years of county advocacy and policy work, trying to show how underfunded county administration was across the state and for many, many years, we were successful in then a legislative bill that created a funding model and tried to look at the underfunding. So Senate Bill 22-235 looked at not only what is the existing funding and trying to redo the funding formula, but a component of it was to also look across the country and see were there best practices we could pull from to reduce the administrative burden and also the policy alignment across the programs, since we have an integrated system. And then there's an annual report that goes to the JBC with that information. So November of 2024 was the first annual report that was provided. And to no surprise, what the it was a third-party contractor. What they showed is that the system was $30 million underfunded to counties to administer these programs. And so a lot of work has come out of that. And we were very grateful to the Joint Budget Committee for an additional $25 million that was appropriated in state fiscal year, the last legislative session, but for this current state fiscal year 25-26. So I will show you how much we received and where that comes into play then for this current year. So the table at the top is our county administration allocation for fiscal year 24-25. And then at the bottom, you can see what our new allocation is. So our county administration allocation for last year was just over 10.7 million. And we spent just over 11.4 million. So we were $750,000 overspent, or spending at about 107% of our allocation. For that 10.7, the county contributed over 1.8 million. So that 1.8 million is included in the 10.7 for the allocation itself. It went through the closeout process that I spoke to earlier, and we received an additional $581,000 to help cover our overspending. And then at the end of the day, we were responsible for still covering $169,000 that was not covered. So that will come out of our fund balance. There isn't another program like TANF Reserves that helps offset that. This goes straight to our fund balance when it's closed out.
Heather, can you talk for a second about overspending, why that happens? It's not poor management, but it is sort of it's built in for counties.
Yes. So these programs, so you'll see overspending in several key programs that we're going to walk through. All of them are significantly underfunded. We've had a lot of conversations about that. These are mandated programs that counties are required to provide. And when the funding doesn't keep up with the workload or the cost for counties to provide them, staffing costs to administer the programs and meet those federal requirements, it is constantly a fine balance of, do you meet those federal requirements and just cover and overspend your allocation? Or do you not meet those requirements and stay within budget? And so there is overspending in several areas because we do not receive the funding that we need to be able to meet these mandates. And that's why the closeout process is there. There are counties that underspend. We all have the same formula that determines what allocation we get. The formula is the exact same for Los Animas County which is a fraction of our size. It's the exact same for Denver County, which is much bigger than us. So it's the same formula, but it doesn't always play out in the same way. The cost of living looks very different, which impacts those we're serving as well as our internal costs. And so it is constantly trying to find that balance. And you'll hear us speak to where we're having to take some pretty drastic measures in some programs to find that balance better in the future, because we cannot continue to overspend at this rate. And we are doing a lot of work to identify what are those client outcomes that we want to measure most, to make sure that as we're trying to find that balance, we're not unintentionally harming those that we're serving even more so.
Commissioner Shattuck McNally.
Thank you. I might have to have you repeat that again later, but I'm still like, my head's just trying to wrap around all of this. But when you talk about unintentionally harming those we serve, which of course that is not what we at all ever want to do, how is this also a burden or a strain on staff because of the knowing that what this does to overspend and things, and how does this also strain or put extra stress on staff to do that? What are the other unintended consequences? I'll use that word loosely for this kind of system or what's happening.
I think the term fits, unfortunately. So there is a lot of stress on all of our staff. My approach to that stress is to always make sure they have as much information as I do, even when the information is not great. I want to over-communicate so that our staff aren't creating their own stories too. And so you do hear a lot of questions about layoffs and reductions and am I still going to have a job? And while they're also seeing more and more people come into these programs and come into our lobbies. So there is a lot of stress. And so one of the strategies you will not see in any of these slides is a reduction of any of our employee well-being or support resources or our partnership with HR to make sure that even when the news and the information is not what any of us want to hear, they at least have the right resources and support to be okay as individuals too. So there is a lot of stress across the board with federal changes, with budgetary changes, and we still do a lot of our, unfortunately, COVID practices that grew out of the pandemic, where we're doing virtual town halls so that they have a chance to ask us questions and hear directly from me, directly from our leadership team of what are we talking about, what are we looking at, and what does it mean?
Thank you. And I know that we've heard many sessions, you have done a lot of programs and a lot of innovative things to support staff and your leadership team. And I know that's still a lot of that's in place. But I also, think just like with first responders or emergency room personnel or nurses, these are very much frontline heroes who are working so hard trying to take care of folks, and we need to take care of them to be able to take care of everyone else. And so I figure all this uncertainty is, of course, not good, but I'm just wondering what other unintended things we're not hearing or understanding. So I appreciate your answer very much. Thank you.
Thank you. So switching to the bottom table there, our allocation for this current state fiscal year. So this team has absolutely rocked it for the last several years. The workload, when we look at more than 3,000 additional families we're serving in SNAP, they have all done it within existing resources. And so this team is actually meeting very significant performance metrics that healthcare policy and financing gives to us that then actually provides a financial incentive. So in July of 2025, they met every single one of the performance metrics, which resulted in us getting over an additional $500,000. And then the slated amount for performance metrics for next July is $465,000. And so there is right there an additional $1 million available to us. And they have gone above and beyond, and our timeliness and our quality of administering these programs, we've actually been asked to share what we're doing with other counties. So Vanessa's leadership and the leadership of her team and her managers certainly needs to be called out here. our allocation with the JBC's additional appropriations and the new funding model, our allocation is going up more than 12%. So our allocation alone will go from 10.7 million last year to over 12 million this year. So a significant bump, which is really nice to see. So our total program budget for this team is right at 13 million. So we have been holding on to vacancies across different programs as we reassess workload and finances. And we have actually released 9 vacancies. So we're recruiting for 9 new staff members they're called community support specialists. Because of the significant bump in the allocation. So that will help us prepare for the federal changes while we reassess and really try to understand what those changes will look like. It takes about 9 to 12 months to get a new community support specialist trained. So we're trying to get them into training now so that next October, when all of those changes come, they will have their head a little bit above water to help be able to be fully functioning in that role, to be able to assist.
Commissioner Cavallo has a question.
Thank you, Madam Chair. So this increased allocation is good news for the current year. Is this something that they figured out with this new funding model will be sustainable? And is there some mechanism in place to allow it to increase based on inflation, rising costs to administer?
So the funding model has to be updated every year with new data. So it should continue to increase. The funding the state has, or the money the state has to make it sustainable, I think is the biggest question. If there is an additional $170 million that hits the SNAP county admin line that the state has to come up with, I don't know that this allocation is going to be sustained at this level. I think those are the exact conversations that are happening right now about how to sustain it with the money, but the funding model itself is sustainable and will be tweaked every single year to refresh and then determine what the formula looks like.
What about applying other findings from that November 2024 report? Are those also being considered, or I think the report is annual, so there should be one coming up this November. How are we learning to be more efficient and, some of the things that are coming out of the report?
So the remaining pieces that are in the report are really greater alignment between CDHS and healthcare policy and financing.
That's right.
And trying to seek more policy alignment so that it's easier to administer the programs at the county level, which will drive significant efficiencies. So there's a group that meets and we have a work plan. There's a project manager from the state that's working on all of those strategies. That's really the biggest area that we need to continue to move forward.
When can we expect deliverables?
So one of the biggest deliverables was for the additional funding that the JBC also appropriated for Colorado Benefit Management System and making significant improvements there.
Okay.
So there are deliverables each year.
Okay.
And like you said, there should be another report here in the next 6 weeks.
Okay, thank you.
So shifting gears then to TANF in Colorado, we call it Colorado Works. So this is a program, we've had a lot of conversation about the budget pressures that have come to this program, largely from increases to basic cash assistance. So with the legislative bill that passed in 2022, for the next state fiscal year, there will be a 4.8% cost of living increase to basic cash assistance, so we'll call it 5%. So the challenge with that is that there has not been any additional funding provided to TANF. It's all absorbed. We have to absorb those basic cash assistance increases into our existing allocation. The other challenge is that we're seeing our allocation continue to decrease by 5%. This is now the second year that it's happened, and it's really because there is much higher spending in basic cash assistance for bigger counties that then results in other counties taking a decrease as we try to slice the same pie in different ways each year. So we have not had any emergency resources or what are called supportive service payments in TANF for 18 months because of those budget constraints. And we stayed right within budget in TANF last year. So our TANF spending is our case management team that are doing those barrier reductions, trying to help people increase employment or gain employment to get off of TANF, and then the basic cash assistance. So our allocation last year was just over 7.3 million. We spent just under 7.3 million. And so we were about 53,000 underspent in TANF that will go to our TANF reserves. So a very different closeout process in TANF. And then you can see the significant difference there in 25-26. So again, our allocation is decreased by 5%. So our allocation goes down to 6.9 million, but our estimated expenditures will continue to increase because of the basic cash assistance increases. And we anticipate having to use as much as 700,000 from TANF reserves for this current year.
Commissioner Shattuck McNally.
Thank you. Sorry to keep asking, but
Oh.
back to your comment about the same pie and different, the slivers changing. Is there a mechanism to where the bigger counties are taking more and more of the pie, that is, sounds like the pie is gonna get smaller? Is there a mechanism where the bigger counties, who I'm assuming is also seeing the same needs, that they are not gonna shrink more of the pie, so all the other counties have to get smaller and smaller?
That's exactly what's happening.
But is there a mechanism that they're gonna put in so that says, okay, you top 3 counties, you can't have the whole pie. We have to have some of this for the rest of the 60 counties or 50 counties. I mean, I'm just,
There is not
no.
currently.
There is no current. So it could continue to trend this way, or we'll have smaller and smaller slivers of that pie.
So, yes, that is the way it's going to trend. And there's a lot of conversation, and Commissioner Stevens sitting on the Works Allocation Committee, which oversees this allocation. There's a lot of conversation about, some of those big counties have also depleted their TANF reserves entirely. And so counties are depleting their TANF reserves, at the same time that expenditures are going up. And so there is a lot of legislative work that needs to be done in this program to try to make sure that counties aren't pit against each other for that exact reason.
Thank you. I appreciate it, and thank you for your service, Madam Chair.
Yeah, I mean, there is a lot of work that's being done, and not only kind of, is this the right formula, but, TANF is, and Heather, correct me if I have any of this wrong, because I'm fairly new to this game, but TANF is also an entitlement in our state, even though it's not a federal entitlement.
Correct.
And so with basic cash with the bill, it was was it a House bill?
22-1259.
There were increases in basic cash assistance, which is, good for people who are receiving that, but at some point, we don't have the dollars to be able to bring new people into that. And so, but right now, we're not able to even have a freeze on that, right? Because of because at the state level, it is an entitlement. So there's a lot of moving pieces of things that could change that might make this more sustainable into the future. We put forward some suggestions that were not taken in the past year. I think as the budget gets tighter, I think that we will start looking at, those more closely because it isn't sustainable going the way it is. And so I guess that kind of encapsulates the work that we're trying to do, is really work with the state to make sure this is sustainable into the future, and what does that look like? And does this indeed need to be an entitlement? And is basic cash assistance the only way to address some of the issues that Colorado Works is trying to address? So, in a nutshell, I would say.
Yes. There's a request for information that is going to the Joint Budget Committee it technically goes from the governor's office, that is looking at the constraints in TANF, child care assistance, and child welfare collectively. And so that will go on by September 1st. So we've been very involved in trying to put forward those ideas and see what the state will put forward in that report. So that will be very telling here in the next couple weeks. And then the JBC will have a lot of conversations over the next several months of what to do about it.
There's dozens of suggestions in all those areas, and Heather has obviously helped me sort of weigh in as a commissioner. In this surveying, the counties have come up with a lot of good suggestions. The state has come up with a lot of suggestions, some of which need to be more fully vetted, others which don't really seem to be very workable, as they were presented. So there's a lot of work in this space. And like I said, I feel like such a novice in this space, but it is something we need to fix for sure.
Okay, so that is a great segue to child care assistance update. So this is another program that received $15 million in an additional appropriation from the Joint Budget Committee for last year, and then $10 million this year and every year moving forward. So this, we continue to be on a freeze. So 18 months now we've been on a freeze. Our freeze went into place February 1st of 2024. We were the first county to go on a freeze. There are now 19 counties with a freeze and 5 with a wait list. We're currently serving 527 families, which is 796 children. We were up over 1,000 children at the time we went on the freeze, so we have seen a significant reduction, unfortunately, in the families receiving CCAP. And we have come to within budget in those 18 months as well. I'll show you that on the next slide. So this just shows the number, even with the freeze, that first line there, we still see 200 applications or more every quarter. We encourage the community to do the application because then we can maintain a list of, if we were in a place to switch and have a wait list where we were able to add families to the program, we already have their application done. So it makes it easier from the family's perspective if we get to that point. And then, like I said, there are almost 800 children that we're serving. There are 527 children on that freeze list. And so we monitor that every month. Colorado did request an extenuating circumstances waiver from the federal office to delay the implementation of the federal changes that are coming. As we're hearing from the federal office that they might actually roll back those changes entirely. And so we didn't want to start all of the work to implement it and fund it if the new federal administration is going to change that. So we should hear actually this week on the status of that waiver. So our child care assistance program allocation last year was almost 8.4 million. And we were, like I said, right at budget. We underspent by 65,000. And then, so our underspending actually went into the closeout process to benefit other counties that were overspent. Our allocation for this year increases slightly. $250,000 is what our slice of the 15 million, or 10 million, my apologies, 10 million. We didn't benefit from the 15 million last year because we weren't actually overspent. Had our freeze not decreased our spending, then we would have received some of that 15 million, so we did not. And our share of the ongoing increase to our allocation is just shy of 250,000 this year. So unfortunately, we do not anticipate being able to change from a freeze to a wait list because there is another round of provider rate increases that we will have to absorb into our allocation starting October 1st. This is the last of the 3 for the state to come into compliance with an audit finding from several years ago. So we don't know what the total cost of the new provider rates will be for our CCAP providers to know how much of that additional funding that we're getting will actually be used towards that. So we'll reassess and obviously have this on our agenda every time we come back before you.
Commissioner Kefales.
Thank you. So what's it going to take to move to a wait list and actually start accepting new children and families into CCAT so they can get access to quality childcare?
So as we've tried to estimate it, it's very hard to project the costs in this program. When we move to a wait list, there are actually additional populations we're required to serve that we're not serving now with a freeze. So when you're on a freeze, you're not required to serve anyone that is not already in the program. When you move to a wait list, you're required to serve individuals that are unhoused. There are some other designated populations you're required to bypass your wait list, so it makes it harder to shift. We estimate that it would probably require close to $1 million additional in our annual allocation to be able to switch to a wait list.
And what you just described applies to people, new people on TANF? Because I thought if they were on TANF, we have to provide CCAP.
So that was, it's been a very interesting year. That's what the State Department's told us, is that we were required to bypass TANF and child welfare families both. And when we asked for those legal citations, they weren't able to find it. And so they reissued a memo saying, our apologies, we can't find the citations, and so you're not required to bypass those populations. So we do have, I think it's close to 20 families that are receiving TANF that are on the freeze list because we're not able to serve them. And we have about 115 children that we are paying for childcare out of the child welfare budget because childcare is a safety support to that family. So it's impacting our child welfare budget and very directly impacting TANF families differently than it has in the past.
One more quick one.
Yeah, please go ahead.
We have to get to child welfare.
More good news to come.
I hope there's some good news somewhere. My follow-up question is, you mentioned earlier, Heather, that some of the proposed federal requirements may be, quote, rolled back. But my recollection is that those, from a policy standpoint, they're actually good ideas, except just the money isn't there to implement them. Could you speak to that just a little bit?
They are great ideas. They are policy changes that serve families and providers
Cost share,
better.
things like-
It reduces so parents pay a copay, if you will, a portion of their income towards the subsidy for childcare. It would lower the percentage that they would pay. It would add supports to providers. And they are very costly changes, and there wasn't any additional federal money. So that's what we're trying to figure out, is what the new administration is going to do with those changes. So I'm going to turn it over to Thad, and we're going to, you can actually skip this, Dave. Yeah. You all heard about child support yesterday, so we'll skip that slide. Thad's going to give you updates both from the caseload, workload perspective, and the financial overview for child welfare.
Thanks. Thad Paul, Division Manager for Child, Youth, and Family with DHS. More good news to come, and there's a nugget of good news in there, and we'll jump to that here shortly. So I'm going to walk through kind of the allocation, the models, the formulas, and then we'll get to the kind of the summary of how we ended the year, and then impacts that we're seeing already and concerned impacts moving forward. So the first slide is kind of that block allocation. So there are three main allocations. There's a couple other smaller allocations that fund the service that we do, but there's three main allocations: the child welfare block, core services allocation, and then what we reference as the workload allocation. So I'll start with the block allocation. We wanted to make sure to highlight this formula because this is the first year of this new formula in this allocation. So this current fiscal year, for fiscal year 20, state fiscal year 26, our allocation in theory is based on this formula. And the reason I say in theory is because there was a reduction limiter applied So long story short, basically, they held everybody harmless because this new formula is going to have some pretty significant shifts to the allocations moving forward. So I'll cover that here in just a few. Give you a little context, so the 40% is the average case counts. Average case counts basically are the things like how many referrals, how many assessments, how many cases you're open on, and it's a 3-year rolling averages. As are all of these. They are all 3-year rolling average of data points. So the average case counts is taking in referrals, assessments, cases. There's a little nuance in the case, and it's you get a little more credit based on the case type. So program area 5, which is child protection, out of home, might get a little higher count versus a program area 4 that's in home. And so it's really nuanced, but just a high level. 40% of the current allocation formula is driven by the case counts. 25% is driven by staffing, in essence, the staffing costs that the state sees in the management system. 20% is coming from the average service spending, so those are the services that we're paying for out of block to help support families in the community. And then 13% is indexes, and indexes is a funny term, and in essence, there's several different things that is in indexes, and that includes things like child population in counties, poverty level in counties, cost of living, and then also a factor for underserved populations. So basically, those that are most marginalized in communities, there's a factor to provide more funding to counties that have a higher population that maybe is underserved population from their community. And then the last one is a 2% for kinship. And I know that sounds a little off, like why wouldn't we be serving more for kin? And really this is specifically for the House Bill 24008 that created funding payments for non-certified kinship care. So that is not something that we are currently paying for in the child welfare block, but it is coming in next year's allocation. So we started with the model started to get built around capturing that data point, because that is a cost that we are not absorbing now that we will be required to absorb starting next fiscal year. So all of these funds basically fund all, this child welfare block fund staff, administrative costs, travel, facilities, training, out-of-home placement costs and expenses, which have seen a pretty significant increase over the last 4 or 5 years. The daily rate for across the board in all levels of care have had significant increases over the last 4 to 5 years, which is a significant driver of our spending. And then it also has some cost allocations, some client services. You'll see on the right there, last 2 years, not all overspending was covered at closeout. And this year, with the 3 funding sources together, so I put it on here because it's all 3 get rolled into this, $30 million as a whole for child welfare was overspent. So that's workload, core, and block. The reason I capture it here is that every one of those other formulas and allocations, the closeout process, whatever is not covered there, rolls back into the block. So really the block becomes the holder of all at the end of the day. The worry, obviously the significant worry we have is with the formula as it is now, if they did not have a 0% limiter this year, we would have had a $1.5 million reduction to this year's allocation. So there's some pretty substantial moves that happen in allocation, and we believe that it is likely that there will be a change in that reduction in that limiter next year. Will it go all the way to automatically to the 1.5? We don't know. There's a lot of conversations to be having there, but we have to do some planning around what we think will come, and that's a $1.5 million reduction. That's a pretty significant shift, and so I'll go through each of these other 2, and then the last slide 2 or 3 down is kind of walking through where we ended up, and this will make a lot more sense once we get there. So core service allocation. This model has been the same model since I don't remember, like as long as I can remember. It's the same formula that is the driver. There is a pretty significant disparity happening across counties from the core service allocations. So we are working, I'm a member of the allocation methodology work group with the state to look at both the child welfare block allocation model, but also the core services. We're advocating that they look at this one as well, because there is a substantial difference across counties, which is a significant concern for many counties. So core services really ultimately is intended to provide services to families to either maintain the children in their home or get them back to their home as quickly as possible. That is the true intention of core services. I'll pause. I thought I maybe saw a question coming. No.
I'm fine.
Okay. Yeah, that's true. There is no, that one component, there is no federal draw for there's no federal money that goes into core services, but what we provide in core services actually does help us draw $40 in other areas. So the reason that matters at some high level is that this last year, core services got closed out because of the extra 4E earning, and then they were able to take the general fund that they didn't have to spend on core services and moved it over to the block to help it close out. So it's an important piece. As you can see on that top one, the Department of Human Services has multiple years in a row asked for a reduction in core services, which obviously is a direct impact to services to families, so that not something that we're in support of. And if you start reducing what we do in core services, you're also going to reduce the 4E draw, which is going to have another unintended, or maybe unintended consequence. I'm not sure what the right terminology of that would be. So core services, we actually got a little bump this year, so that's the good news. Make sure we layer a little good news in here today. Then the next main allocation formula that we have is the workload. We call it the workload because it was created based on 2013, 2014 workload study that was done statewide. They allocated a certain amount of money, JBC allocated a certain amount of money to basically add workers to the child welfare workforce. The estimate back then was we were somewhere around 750 staff positions short. They funded about 150, so we still never got to the full funding. A significant challenge with this allocation is that it doesn't actually cover the full cost of the 14 positions that you see here. So you said you got 14 positions, but they only gave you $68,000 for each position, which is nowhere close to the full cost of benefits and all the stuff that goes into a salary. So what ends up happening is that this always is overspent and always ends up rolling back into the block as part of the closeout.
So I have a new term, maybe
Uh-oh.
cascading consequence.
There we go.
Trying to be careful, thoughtful. So I know we ran into one time with this with the work I was doing with the school districts where they ran a bond and said 54 positions, but then the bond never collected enough money to pay for it.
Yeah.
So this is the
Same
same
thing.
kind of thing. And those FTEs are based on current, what's the word I'm looking for, current cost of living expenses, or it's based on
was
the
people.
old, just people, so
It
there's
was
no.
just it was not even based on the cost, it was based on the number of staff that you had at the time and how much staff they thought you needed to be added
Okay.
to get you to whole. And so obviously they only added, like in the early, it took several years for us to even get to 14, but we've been at that same 14 number for many years. This last fiscal year, JBC added some additional money into this one. So really all it did is made us closer to whole for the workload allocation. It didn't add actually money, if that makes sense.
Okay.
When they implemented this in 2015, they did it backwards, in my opinion. They said, here, the JBC said, we're going to give you $1 million. And the State Department said, okay, we're going to try to use that $1 million to fund 200 positions. And so when we take $1 million divided by 200, that'll give big counties $65,000 a year, and it'll give small counties, I think, $40,000 a year. The cost for a position for us is almost $100,000. So it's only funding 65% of the number of positions. And so it is constantly trying to stretch it further. And then the state said, Larimer, you get 5 positions in the first year, so whatever 5 times 65,000 is, that's what your amount is. So it was very backwards in terms of the implementation because they started with the money first and not the cost. But I think we're very accustomed, unfortunately, to having that happen in all of our program areas. The cost is not often part of the conversation from the beginning.
Thank you. I'll just go ahead and say cascading consequences. Thank you.
So this slide will cover our child welfare spending for this last fiscal year, as well as our new allocations for this upcoming fiscal year, state fiscal year. So first line up there is the child welfare block. You'll see if you go all the way over to the right, 1.5 million overspent. A few slides later, we'll get to some of the components of what we've been doing to try to become more in alignment with our allocations, and there's a whole lot of factors that drive spending, and I'll talk a little bit more about that in a little bit. Something to note is that we're not calling out the county match on this because the county match for the most part is 20%, but there's some that is 10%, there's some that is 0%. So it is so we just didn't call it out, but generally speaking, it's 17 to 20%, similar to most other programs in human services. So our allocation, you can see our overspend in that. We do get funding from a few other sources that you can see there. Educational stability, Chafee. So educational stability is to help provide transportation for kids to maintain in the school that they were going if you had to place them out of the home. Chafee services, promoting safe and stable families. The reason we don't call those out is first off, they're relatively small in the context of it all, and ultimately the overspending in any of those rolls back to the block, and we overspend in every one of those. That also ends up rolling back into the block. The next main funding source is the core services. As I mentioned, that's really intended to be the service delivery to families, to keep them in the home or return them children home as fast as possible. Pretty substantial increase in overspend there. There's lots of factors in that, including cost of living. Right? Not just the cost of living our staff that we have to pay for that are actually delivering a service, but our community had an increase in their cost of living, so they needed higher rates from a core service contract. So we don't see substantial changes over time from our core service allocation, but yet the needs of our providers to serve the families has increased, so they had to pay their staff an appropriate level. So we continue to see a growing gap of allocation versus spending in that model, and then the workload that we spent a little time on as well. So overall this year, almost 3.1 overspent in those three funding sources altogether. Fascinatingly, we closed out. So we were anticipating, we do calculations, a lot of calculations to try to figure out how do we fund programs out of the right three sources, because as I mentioned, each of those allocations, it actually closes out to itself. There's a distribution that happens at each one of those before it rolls to the block. And so we make some adjustments to maximize the funding in all of those so we can get as close to closed out as we can. Historically, we have always planned to overspend as a whole because we have always been historically statewide underspent and been covered. The growing trend is that the risk is growing. Like now, last year there were 3 or 4 counties that were not covered, the same as this year. And with a lot of other factors that are coming, we anticipate it to be even worse this next fiscal year. So that's the bad news. The good news is we were fully closed this year. We didn't have to use the fund balance to help support this, or TANF reserves to help support our closeout process. And we're doing a lot of significant adjustments to try to continue to get closer to our allocation model. As we get closer to that allocation model, places where we're having to do reductions will have impacts, or have the potential to have impacts to the community, and so that's the work we're doing to figure out where do we make the adjustments so we're not impacting families. This next year allocation, we get about $400,000 more this year with all three of them rolled together. Most of that is coming from the core service. The block is basically flat, and the workload staffing is flat. So we anticipate our projected at the end of this year right now as we stand would be about $2.5 million overspent in those three buckets based on our projections at this point. I'll pause there because that's a whole lot of stuff.
And I think the only piece I'll add, so Thad's going to walk through what does the current work look like that got us to that 3 million over. And then he's going to walk through what reductions do we have planned that are going to get us closer to the 2.4. And what I would say just before we dig into that is 2 pieces. We now have the second year in, I think, my 10 years of tenure with Larimer County, we're now the second year where counties have not been covered at closeout. And so I think we need to pay very close attention to that. And there's the farther you spend above your allocation, the more risk there is. And so we were the last county covered at closeout, and there were 3 to 5 counties that spent more than us that were not covered at closeout. So we have to pay very close attention because I do not believe there will be coverage in next year. I don't even think there will be 2.4 million in coverage of next year. 2.4 is still too far above our allocations in this current year. So that'll walk through the reductions that we are planning for. And like Thad said, if the new formula plays out like we think it's going to for state fiscal year 26-27, that 2.4 automatically becomes 4 million over, because our funding is going to reduce by 1.5 million. And so that will wipe out all of our TANF reserves, and it will utilize as much as 25% of our fund balance. That's too far above our allocations, and yet we know that these are direct services to the community and direct positions that are managing those cases. So one of the conversations that we have already had with some of our contracted partners are those that we partner with for educational stability, Chafee services, and promoting safe and stable families that we've called out up there. Historically, we have given them larger budgets than the state allocation provides to us, and we just cover the overspending from the block. We can't do that anymore. So we've had a lot of conversation about how we've approached this with our Office on Aging community partners, and unfortunately, collectively, we have to live within the budget we get from the state. We've had that conversation with our community partners in this program area, and they will have to live within the allocation we get. But Thad will walk through other internal reductions, because I don't believe that I would be much more comfortable not being over 500,000 in the block and 500,000 in core services, but we're more than double that in what we're projecting for this current year.
Commissioner Kowalski, did you have a question?
Well, I think so. So I think you may have answered, but in terms of covering this difference, that'll come about from reductions that we'll talk about. That'll come about from dipping into TANF reserves, county TANF reserves, and it'll also come about from fund balance transfers.
If that's where our spending ends up at the end of the year, yes, that's the order of operations. But we're trying to reduce even from that 2.4.
If our TANF reserves become zero, what are the cascading consequences of that?
Then we're required to use fund balance to also cover TANF and CCAP overspending. So TANF reserves has to help buffer the overspending in all three program areas.
That's right.
And so if we deplete it entirely with child welfare, there is no buffer for TANF. We've already covered the basic cash assistance increases, and we will be on a CCAP freeze indefinitely.
Sounds like pretty serious cascading
Yes.
consequences.
Yeah. So that'll walk through the workload and some of the client metrics that we're tracking, and then we'll cover the reductions that we're talking about.
And just to highlight or emphasize maybe, as Heather mentioned earlier, these are mandated services, right? Like we are responsible to meeting the needs of families, and so it is finding that line on how do you meet the need, but do it more cost effective, if you will. But we have to make decisions on where is the right line, and so we'll cover a little bit of that here shortly. So this slide is kind of the snapshot of referral and assessment over the last quarter. So the left column, quarter 2, is the one to compare to of 24 versus quarter 2 of 2025. So the far left and the far right, very similar in the context of referral assessment. The reason we highlight far is that is our, we have a differential response. We are a differential response county. So when we have an assessment, we, as much as possible, go out and assign it as a FAR case, because there's all the research that shows it's a better engagement model. It creates just as much safety, and there's a lot of pro benefits for families. And so that's what we always like to highlight FAR. But it's our assessment, our front door looks very similar year after year. We're not seeing reductions necessarily in these, and there are always seasonal moves, right? Schools and school year and those kind of things are drivers on seasonal influence on assessment, referrals and assessments. But overall, this one's a pretty balanced workflow. The one that's not balanced that you'll notice here is on the left is quarter 2 of 2024, and this is the number of children that are open to a case. The far right, quarter 2 of 2025, is the number that we did in just this last year. So you can see it was a pretty significant reduction in the number of kids that were opening a case. So obviously that's something I'm watching, and that becomes a worry, right? So are we unintentionally not opening families for services because we're worried about the resource availability in the case side? So a metric I always like to use to balance this out is, are we seeing an increase in reassessments for families that we close at assessment? And we routinely are the best, if not the number 2 best of the big 11 in not having reassessment rates. So even with our reduction that are not going to cases, that tells me that we're still assessing and working with families well, and only opening for cases the ones that need it. Historically, I think some of this reduction we've done a lot of work over the years in a prevention continuum, right? Like we have a lot of ways to hand families off to other partners in the community. And with the changes in Medicaid, the changes in these other programs, there's a cliff effect coming of not having that availability in our community. So I could see a space not too far in the future that our open case rate starts coming back up, because that is the only avenue to help support families. And then thus comes back the workload.
Commissioner Shaddock McNally?
Thank you. I'll just add to that, but when we look at these numbers, that 856 doesn't mean that stayed in quarter 2 of 2024. That could be carried over.
Yeah, absolutely.
So these are accumulating.
Yep.
So this number,
Some of them are duplicated from quarter. If
Yeah.
the case remains open, that same child might be counted in multiple
okay.
quarters.
That's right.
So that's kind of in there. We're not seeing all of a sudden there's 2,000 cases or something.
Right.
These are some duplications.
Yeah.
Okay.
Yeah, I mean, many our length of stay generally is about 10 to 11 months. So they'll show up for multiple quarters in this graph oftentimes. Yep.
That's helpful. Thank you.
Yep.
But I think the piece I would add, before we switch to the service authorizations, this decline, FAD's been tracking this for many years, many years, and this decline is steady. It is what we have seen over the last several years, that we are seeing a pretty steady decline in caseloads and the number of children. The caveat is, though, the cases are not becoming easier, right? The level of severity and the safety needs is growing. So when we get to the reductions, we can talk more about that. But we are continuing to see a downward trend in the caseload. And so we have to adjust to the staffing then appropriately. So we'll cover that in a second.
And not only do I look at it quarterly, I look at every month. I do a workload check of every one of my staff, so I know where our workload numbers are. So that is something we're constantly paying attention to and making shifts on the back end, if you will. This next slide is the services that are being provided to families that are open as a case. So this has adult protection on the top line. That this is part of the activity report, so this slide is right from the activity report. The child welfare one obviously is the middle one, and that is ours. It would make sense, right, that if you're having a reduction in the number of kids you open in a case, you're going to have less services. But this reduction is exceeding it. That's not a one-to-one reduction, and this is also becoming a result of us having to make decisions on not being able to provide resources to families because we don't have the resources or allocations to actually do it. So it's a combination of a reduction of cases, a number of kids, but it's also a reduction of not having enough capacity to actually do what we would like to do versus what we have to do to make sure it's safe in addressing risk. The next slide is maybe the one that is my growing concern. And this is a KPI that you guys see from the HEH performance measures. So this is the remain home measure in child welfare. The numbers look a little different than what you see on the KPI. They don't look different for the last few years, but this KPI used to be historically was measured very different from what you see. But the reality is what this is defined as % of children who maintain in their home. So basically we opened a case and we did not have to place them in and out of home setting. So if you see this graph, what is the benefit, I guess maybe I'll go to the benefit. The good is that bottom purple bar is the average for all the big 11 counties. So they are substantially lower performing in keeping kids in their home when they open them in a case. So that means we're still doing good service. And this continues to reduce year after year. So there is obviously a growing concern, and I think, I'm speaking a bit to the choir. There's a lot of unintended consequences when you place a child in and out of home. A lot of possible long-term negative outcomes when a child has to be removed from the home. And so the less skilled that we are at keeping them in their home on the front end, the longer term, my worry is the long-term well-being of the children in our community is getting worse. And because of the trauma that comes with that, all the stuff that comes with having to have a removal. So this is the one that is the most concerning measure for me as I see as we're moving forward, and it is very much is it a conflict of both not having enough resource to do what we want to do and really meet the needs, and an increase, as Heather mentioned, an increase of acuity level for our parents and kids that we're serving. We've spoken many times of the high acuity crisis across the state for our kids, but it's not just a kid high acuity crisis, it is a family high acuity crisis. And so as you have a reduction in resources availability to support them and an increase of need, that creates this environment where you have less ability to keep kids in their own home. You compound this by what is coming with the Medicaid work requirements. Medicaid is often a funder of services for families to help support them. So if we have less families available to have Medicaid, that means we have even less service available to help support keeping the children in their home.
So to put an even finer point on it, one of the things that we are constantly trying to balance is if we make too drastic of a reduction in our core service spending, we will drive up a cost in the block if that child comes into foster care. So, because we pay the foster care rate out of the block if we can't pay for or find the right service to keep that child home. So the funding streams in child welfare are constantly in conflict with each other. And there is that constant tension. And so, as Thad said, this is one that we are constantly watching to see, are we keeping kids at home whenever we possibly can with services? And there has been a steady decrease over the last 8 years in being able to do that. And so watching, is that because of the acuity and the severity of the needs of the family, or are we impacting that more than we would want to with the budget reductions? And so watching that every single month to see if we need to reverse course on any one of the decisions that we make.
Do you feel you're collecting the kind of data that supports that kind of analysis, or do you have to start collecting a different kind of data related to acuity?
Child welfare has a little better benefit than what some of the others do. There's a lot of data that happens at the state that they have on ROM that we have access to. The public has access to their own. You can see community data from that level. So we have a lot of support there. We have our data team that does. I keep them very busy. It's on Jill's team, so they are doing a lot of stuff, and they love meeting with me because they come up with 72 other ideas every time we meet. And there is a capacity there, right, to be able to get there. We do a lot of work in our supervisor meetings. We have a lot of structures built around our system to make decisions as a group decision making to help make good decisions and being aware of. And that is balanced very much by having facilitated family meetings to make sure we're making good, safe decisions. I'm worried that we're getting close.
Yeah, I guess I'm just wondering, how do we know when we hit the tipping point, when it's programmatic or when it's really the acuity is just higher?
Yeah. Good segue into the reductions. Thank you. So the top slide here is highlighting, or the top graph up there is kind of highlighting reductions that we made over the last 2 years. Like, we saw the writing on the wall a couple years ago that we continue, like the allocations, the overspending of other counties not being covered, that we needed to start moving the needle. So we've been working at this for a couple years. We've had a reduction of 19 FTE across child welfare, across the CYF division. We've reduced over that time 1.2 million in services into the community. So we're at a point that there's not much more service that we can reduce, and it is all people, honestly, and that is the growing concern. And I'll get to a little bit of a secondary concern that happens as a result if we go too far in that space as well. So we've been working to reduce our spending for a long time. So, it's easy to say, what are you doing? Why aren't you paying attention? Why aren't you reducing? We've been working at it a long time. There are some significant costs that happen in our community, and there are some significant needs. We have some kids that have to be placed out of state, that $30,000, $40,000 a month for them to be placed out of the state. It is not like the service availability in our state is not enough to meet all the needs, and the cost to do good service and really support kids is really costly, and it's a growing cost across the country. The this upcoming year, we have a projection, we're going to be reducing an additional 9 FTE within our workforce. Further reduction of the 283 in contracted services. That's a lot less than the 1.2 million we did the first 2 years, and we're at a place that we can't go any further in the service array. It is only in the staff space at this point in time. And then we discontinued our family assessment and planning team, which is part of our LCIOG, because we were helping to support the work that they were doing in the community. So a further reduction of services that was happening, that was a prevention service, much more than a child welfare service, and that was serving high-risk kids that have the potential to enter a child welfare door because of the high-risk, high needs that they have. So we'll know pretty quickly if we start seeing a real increase in our congregate care placements, because that's our indicator of that's who FAPT was serving. So kind of highlight, I'll pause.
Commissioner Shattuck McNally.
And I mean, I liaison to that group.
Yep.
So I understand, and you guys do amazing work. So is there a way to track since this is being discontinued, and if we see an increase in that, and you're saying that expense, that we can just use this as what we're looking at and discussing with the state legislature or whatever funding sources, if we start, what we had to cut, then all of a sudden we were, spending, because we're seeing an increase in needs.
Yeah.
That if it all of a sudden starts increasing, so we can, look at more prevention
More
is worth.
programming,
An ounce of prevention's worth, a pound of cure, kind of.
Yeah.
Seeing how when that tipping point happens, or if it starts to really significant increase of, I'm sure you'll be tracking all that, but do you know what I'm saying? If all of a sudden it
for
just
sure.
really shifts and we're paying 4 or 5 times more than what we were saving, I just would think it'd be interesting to know that and also contemplate.
What to do different.
Yeah, so-
Absolutely. I mean, we are, I'm sure you hear from we are solution focused, and that's all we're doing is finding solutions on how to best meet the family's needs. The reality is it'll take us a minute to see it, right? It won't be a flip, it'll be 6 months, 9 months, a year and a half before we actually see the possible impacts of that. And so, yes, we'll be watching it, and it won't be the most direct line, honestly, to be able to measure. And it was a question you asked earlier about the impact to the staff, about the stresses that they're feeling and all these worries, right? We need to continue to reduce our FTE because our workload says that we should reduce our FTE. There's no doubt that's where we're going. There obviously will at some point be a tipping point in that, and really our staffing is our only lever we have left to really pull in a reduction. And my worry of a tipping point of getting too far on that is it's not just, I don't want to become an agency that just does the bare, right? We want excellence in our community. And so if we go too far, we have the possibility of impacting excellent service to the community, but also what happens is the ramifications to the stress of staff. So as that stress, we've seen this historically when we were understaffed, when we were woefully understaffed many, many years ago. Turnover begets turnover, and when you get uber stressed in the job, you start looking for other opportunities. And then what that does to your workforce is it moves a very experienced, skilled workforce down to a very inexperienced, less skilled workforce. And so that is a constant balance that we have to pay attention to. And to be clear, we are definitely overstaffed, and we will continue to do reductions there. And there is a fine tipping point in that, just like there's a fine tipping point in the core service. And I track our turnover rates every year, so that is one of my measures. We're doing a lot to help boost up our team. We created a training team in child welfare that is dedicated solely to doing training for our staff. We just were awarded. How can I say? I guess I can say it because we got the email that we were awarded some county funds to the Behavioral Health Administration funds to do MI training for our staff, which is a skill set that is really intended to help support our skill of our staff in working with families, but also in a future state, help us draw some more federal dollar from the Family First. So we're doing a lot of stuff to get prepared and better trained and better skilled in that future so that we have an ability to balance and maintain the staff that we have. Because the reality is if you're feeling stress, but you feel really competent in your job, you're willing to stick with it. If you're feeling like you're less competent in your job and you're really stressed, you're looking for some other option to go. So we're doing a few pieces to try to stay in front of that. Yeah. That's it for child welfare.
So in addition to the stress of our staff, which is obviously concerning to hear about, what about our partners? I mean, with the contracted services, I mean, are they, these are usually nonprofit partners, I'm assuming. I mean, their ability to raise dollars is probably diminished as well. So what are we hearing anything from them about their ability to help and what their budgets look like, or are they doing okay?
I don't know that I would, not okay. Yeah, so I actually participate in we have a Larimer County Wellbeing continuing meeting that me and 16 other community agencies meet on a regular basis to figure out how do we better create a safety net across all of our community partners so that we're not creating massive gaps, and how do we create a community that our community partners, that it's not a competition, that we're all going after the same dollar and then only one person wins and then some other agency or family loses. And so we're doing a lot of work to kind of build the bottom-up infrastructure of that. Some of our service reductions were very directly impacting to some of our community partners. They had to eliminate programs, chasing other grant funds are limited, especially if it's anything coming from the federal space. That's not happening really. So there is a lot of worry happening in that context of the community. We also host a quarterly service leaders meeting with all of our core service providers just to make sure we're checking in with them and hearing their needs and resources. Also, how do we get better at working as a DHS with them? And there's worry across the board, and there's reductions happening across the board, not just because of our cuts, but because of many of the other factors happening.
Are we doing any sort of gap analysis to see what kind of gaps are being created to make sure that agencies are not inadvertently duplicating services and everyone understands how to complement each other? I know that takes a lot of effort and time, and I wonder if the Workforce Center might be able to help with that through their sector partnership for nonprofits.
I think that's a great idea. We are planning on convening a Medicaid-specific group. We received some grant funding from Healthcare Policy and Financing, I mentioned in a work session recently. And so pulling together specifically the Medicaid providers or those that could help us do outreach on Medicaid, that I think could give us a good start, at least from the Medicaid funding, of where are the gaps and how can we adjust accordingly. But broader than that, I don't know that we have.
Yeah, I would say, our prevention programming that moved over to benefits actually created a community of navigator meetings to kind of do just that, because they're all doing a similar work to make sure they're not duplicating service to families. That is also what our well-being community is trying to tackle that as. I wouldn't say it's a formal gap analysis by any means, but it is, how do we get better at being willing to pass a family to another community agency because we have confidence and belief that that community agency is going to serve them well, and vice versa, right? And so that's where we're starting from, is that space.
Commissioner Shattuck McNally.
Thank you, Madam Chair. And that was one of my first questions, was, obviously this is creating new gaps, but also like you said, we might be able to leverage resources and work together across jurisdictions or partnerships. So thank you for asking that question, because that was my first question. My second question is, I don't know what's the right term to look at this, to mention this, but what would be one indicator that would, in this area specifically, that would kind of be a red, like a flashing engine light on the dashboard, that what do we get, what kind of indicators do we have before it kind of gets to where we're able to be proactive and maybe head it off before it becomes a huger malfunction of the vehicle, if that makes sense? What would be one indicator? Because let's say if we let the whole car fall apart, it's a lot more expensive repair than if we paused and maybe just fixed a cheaper repair that would save us in the long run money. Am I clear with my question? What would be one indicator?
A few that come to mind. I think on the front end.
Can you turn your mic on?
Oh, sorry. Thank you. Thought it was still on. I would say on the front end, if we have more gaps in our community, more families are falling through them, then we have more impacts to those social determinants of health that drive to risk and the events that lead them to potentially referrals to child welfare. So I think one indicator would be not only an increase in referrals, but an increase of assessments. Right, that would be one of our first indicators that if we really start jumping up on the number of assessments that we have to go out on families, that means that we're having more families that have more compound struggles and risk and safety happening that we have to respond to. So that might be one of our first indicators to say that the the prevention, what's happening in the community from a prevention lens is driving them into, which then in turn drives into more cases, which then in turn drives to the bifurcation of, can you keep them at home or do you have to place out of home? So it's kind of that path, if you will.
All right, we'll keep rolling because we got quite a bit to go through in the next 10, 11 minutes.
So, and we've talked a lot about the Office on Aging over the last couple of years, so there aren't significant changes there. So I'm really going to focus on this one before closing today. So switching to our Aging and Adult Services programs, Adult Protective Services. So our APS is very similar to child welfare. It's a mandated program, and there is very little we can do to slow down what comes through the front door. We are constantly in response to what comes to us, and being able to then do those assessments and provide case services through case management or a very small pot of service funding. This is one of the programs I am most concerned about because we are spending at 140% of our allocation. And it is entirely staffing. This only pays for our 2 APS teams. And the allocation is really driven by demographic factors of how many older adults we have in the community, how many older adults we have living in poverty, and really looks at the demographic data. And I think Larimer and Weld are still the fastest growing with the aging population. And this funding has been flat for a very long time. And there's an ongoing struggle in trying to make sure that there is sufficient leadership at the state level with this program. This is such a small pot of funding. When we talk, child welfare is talking about, $25, $26 million. This is, I'm talking about 1.5 million. But when we have a $1.5 million allocation and we're spending 2 million, it's really concerning. Because similar to other programs, there is no stopgap for this program. When we overspend, what's not covered at closeout goes directly to county-only funding in our fund balance. And so we overspent by over $520,000 on top of our $1.4 million allocation. There was a little bit that we received in the closeout process, but over $350,000 will have to be covered from our county fund balance. This really is a team of 10. So we have 2 managers and we have 10 staff. So sorry, a team of 12. So we are doing a lot to try to figure out where there are efficiencies. Hannah Ditzenberger is helping with a very in-depth policy and regulatory analysis to see what are the federal requirements, what are the state requirements, and what have we potentially layered on that we need to peel away to drive some of that capacity and efficiency. We're looking at caseload analysis, so similar to really digging into the caseloads in child welfare. We're looking at what is the average caseload and what are the average number of older adults that a caseworker has assigned to them at any one time, and making some adjustments there. And then the third piece that I wanted to make sure that you were all aware, because I know you know Katie Stieber. She is a deputy division manager. She started with us as the Office on Aging program manager, and then moved into the deputy division manager role. She was part of the leadership team with Lori Metz for this division, and I have actually reassigned her to Jill's team. When there was a vacancy that came up on Jill's team in the deputy division manager role, looking at the workload between the 2 divisions and trying to assess if we still needed to fill that vacancy. And the workload is being driven more in Jill's team. And so Katie will change from this division over to operations and organizational development on September 4th, which will then also free up some of the personnel expenditures for both APS and the Office on Aging. And then these programs will report directly to Lori Metz based on the workload. So trying to make shifts internally to reduce spending where we can. But we will still be about the same overspent in this current state fiscal year. Our allocation is remaining flat. Our client services, I think, went down to 31,000 flat. So very flat funding for this program, and yet the needs continue to increase. But the caseloads are not. The caseloads are, we're seeing some decrease quarter over quarter. As you can see here from this time last year, a slight decrease. So we're monitoring that to see if there is additional staffing changes we need to make.
Commissioner Shattuck McNally.
Thank you, Madam Chair. Can you expand or help me understand, you're saying the needs are increasing, but the caseload are increasing, but the caseloads are decreasing. So, but we're having the older population increase. So are less people, in some of this is, I'm assuming, adult protective services. So can you kind of help me just briefly, a very clear picture, what does that look like? Is it where the needs versus case, it sounds a little,
Contradictory, yes.
Yeah, thank you for that.
So the population is growing. We are seeing more older adults in our community and continues to grow every year. And so the population is growing, but the number of individuals being referred to us is not growing. What is growing is the severity in what's being referred to us. So when they are being referred to us and we're working on those cases, and you can actually see it here, most of it is self-neglect. So most of it is individuals that are struggling to maintain on their own to a point where they're not able to care for their day-to-day needs. And it's called self-neglect. It's a terrible term in the state case management system, but they are struggling to be able to meet their own needs day-to-day. So we're not seeing an increase in the individuals coming to us, but when they are coming to us, the severity, the acuity is higher. Around self-neglect, but a lot of that is also underlying mental health and growing mental health needs in the older population. So trying to figure out and continuing to work with CSU and all of the community partners we have to see how we adjust and how can we support those individuals, how do we broaden the support networks and support their families differently, all within the same pot of funding or decreased pots of funding. So really relying on, similar to the work that has been doing, Lori does much the same, and the Office on Aging does the same, of trying to rely on those relationships and those partnerships to figure out how we collectively stretch each other's dollars further.
Thank you, that's really helpful. Thank you, Heather.
Yeah, there's not much time.
So, should be adult, right? What's so just showing the, any questions on APS or older adults? Otherwise, I'll just wrap up and show you where everything landed when we talk about TANF reserves and fund balance. This slide just pulls it all together. So our TANF reserves remained just under 2 million. So, continuing to reduce spending where we can so that when we are using TANF reserves, it's for that emergency situation. And so the top graph there just shows we didn't use any TANF reserves. We actually added to it by about 53,000 this year. And then the bottom table there shows 3 million overspending in child welfare that was covered. And so we did not have anything from fund balance needed to cover that. And then for county administration and APS, what we will cover from fund balance. And so just over 520,000 will come from fund balance to offset the remaining expenditures for those two programs. So that was a lot. And we will bring several of these pieces again when we come back on October 8th to talk about more specifically the future changes from HR 1. But that's where we're at in terms of budget and caseload.
Thank you. Any questions before we leave?
Well, just, is it possible in 30 seconds to share something that's good news?
Sure.
30 seconds you got.
So we were notified, I think, yesterday, like Thad said, we're receiving an impact grant from Behavioral Health Services to implement motivational interviewing that will help us draw down more federal dollars and be able to provide another tool for staff to help serve families differently.
Well, and I would say some good news is that we have some of the smartest people in the state, I believe, working on this problem, and that we're really seeking some help at the state level to really say, how can you help us be sustainable? How can you be more sustainable? And so, people are working sort of on solutions for this, and I think, as much as we can support that, we need to do that.
And there was a bit of an increase that we approved at State Board of Human Services for the core services program.
I would just say, watch the money in the coming year. The shell game could get really interesting, and so keep our eye on that for sure. All right. Well, thank you for all the information. We really appreciate it. It just gives us an idea of how we need to advocate too, and obviously, please rely on us to help you do that work, because we want to make sure that you can all do your work and serve the community. So,
Thank you.
thanks. With that, it's 3:30 and we are adjourned. Thank you all.
Thank you.